arthritis or arthropathy without surgery and without drugs. So it's great to have you here. Happy Wednesday to you. It's always a pleasure to be here with you. Today we're going to be talking about the same thing we were talking about last week, but taken it to a different level, and that is we're going to be talking about spinal research done by neurosurgeons on spinal decompression. So it's great to have everybody here. It looks like we are totally live. I'll go over here so I can see some comments. Please say hello. Love to answer any questions for you while you're here as well. So let's take a look at what we're going to be talking about. So we're going to be talking about an article, and let me get to that. There we go. Now we're looking better. So we're going to be talking about spinal decompression, and this is by Edward Irman. This was a case study done by him, which I'll explain to you who he was in a minute. He was a pretty bright neurosurgeon. And this is highlights by a report by him in the Journal of Neuroimaging in 1998. And we're going to be talking about spinal decompression. So let me see if I can do this. So who was Edward Irman, medical doctor? Well, he was a neurosurgeon that graduated from Yale in 1957 and then practiced in St. Louis and Belleville. I think this is pretty cool. Colleagues of his say that he was always 2 years ahead of everyone in his field, always looking for the best imaging to help his neurological patients. I think that's pretty amazing. It sounds like he really loved and cared about his people. He spoke around the world globally and wrote numerous papers on, performed extensive research as well in multiple sclerosis, which can be a very debilitating disease. He was also an assistant professor of neurology at the St. Louis School of Medicine. So I think that's pretty awesome. I am going to see if I can fix this quickly, if you give me 1 second, because it doesn't look like it wants to play very well. And there, and try to get this so my whole mugshot's not taking up the whole screen. And let's do this. There we go. And put you down there. All right. Now we're, I don't know why. Oh, let's see here. Boom. Okay. We'll get rid of this guy. Yes. All right. Now we're in business. So let me show you some of the stuff that he talked about and quoted. So he said, pain in the lumbosacral spine region is the most common of all pain complaints. So when people go to doctors or neurosurgeons, that is the #1 cause. It says it causes loss of work and is the single most common cause of disability in persons under 45 years of age. Below 45, that's not a good thing to be disabled under 45 years of age. So, you want to learn how to take care of your spine, and that's a big part of what we do here, is that I want to teach you that stuff. And that's from the U.S. Department of Health and Human Services in 1994. So I find this interesting. So if you can, don't look at the picture quite yet, because what I want to do is I want to explain what this means. So here's what he's quoting in his research article that I'm talking about today. Herniated and degenerated, now this is going to be a lot, I'm just going to let you know, and I'll explain it to you in English. So herniated and degenerated discs can be shown in discography, that's where they actually go in with the camera and look inside the disc, to have elevated, so increased intradiscal pressure, that's the amount of pressure inside our discs, made even worse by sitting or standing, thus preventing proper disc nutrition. So that means that the higher the number, when we look at this chart here in a second, okay, well, let's go look at it right now. So if you are laying on your back, for instance, that's about 25 kilograms of pressure through your low back discs. So sleeping posture, right? And then if you flip over to your side when you're sleeping, it goes to 75. Well, like I am right now, standing at a stand-up desk, I have 100 kilograms of pressure going into my low back. But look what happens if I go and sit at a desk and I'm leaning toward my keyboard. That's 185 kilograms of pressure. And that's how most people sit, right? If you're sitting at a desk, you start getting really involved in your work and all that kind of stuff. So you got to be really careful, and you got to know this chart. And so what he's saying is that even sitting and standing can create enough pressure that the disc doesn't get disc nutrition into it anymore. It's not getting proper oxygenation, blood supply, nutrition, and not getting rid of its waste products. That's a big problem. Why is that a big problem? Because when discs are healthy, like this, okay, the disc is nice and thick. The nucleus material inside the jelly is nice and hydrated, and the outer rings, called the annulus fibrosus, are very strong. But when we increase intradiscal pressure, unfortunately, those discs can become diseased if you don't unload the disc. And what can happen is then this disc, these rings called the annulus fibrosus, can start to dehydrate, just like a rubber band you haven't used in a while in your junk drawer. And this jelly, the nucleus, can then start to migrate out of there, and now we have a bulging disc. And if you want to look at it as a different model, you know, same thing, that when those discs become diseased, that nuclear material can start to push out and start to push on your nerves or your spinal cord. And that's not good. We don't want that. So here's what he says. Therefore, decompressing, so doing the opposite, decompressing the overpressurized disc should allow for healing and repair of the disc if it's prolapsed, herniated, or if there's annular tears. Again, those are those tears to those rings like we just talked about. That's big stuff right there without surgery. So you got to realize most neurosurgeons who aren't aware of this information and these tools are doing surgery on people that other neurosurgeons are saying, you don't have to do surgery on the majority of these patients. You can do this naturally. I think that's amazing. So what happens? So remember, when these discs become diseased and get compressed, like you're seeing right here, okay, you've stopped this hydration process. You're increasing the intradiscal pressure into that disc, and the discs become diseased and degenerate. And what you have to do is you got to do the opposite of that. You have to unload, separate the vertebrae, okay, help suck blood back into that disc, suck water back in, suck nutrition back into that disc, and that's how that disc can become dehydrated. And you can do that on a computerized spinal decompression table like you see right here that I used for years in my office. Or the beautiful part is that you can also do this from home with a home-based unit, and we'll talk about that in a minute. So again, taking pressure, let's look at this model right here. Okay, when you have increased intradiscal pressure and that disc is getting compressed and it's squeezing that nuclear material out, when we do decompression, we're slowly helping to create more space, creating a vacuum, a negative pressure to suck that disc material back in and off your nerves. And when that happens, usually pain goes away and function improves and flexibility improves. It's really cool stuff, guys. So here's another slide just to give you an idea of what I just showed you. So I'll go over it quickly here. Let's do this one. So, hey, I see this all the time on Facebook with all my groups. There's lots of people out here suffering. You have a herniated disc like this. It's pushing on the nerve branch. So that step one is to help pull that material back in. Step two is to start to help seal the annulus fibrosus. And step three is eventually get it all healed again. And can that happen? Heck yeah, it can happen. And I'm going to show you that here in a second. So this is Doc again saying serial MRIs of 20 patients. So this is a research project that he did in his office. Treated with decompression tables. Make sure I'm on. Yep, you can see me. Showed up to, look at this number. This isn't 10% or 15%. 90% reduction of subligamentous nucleus herniations in 10 out of the 14 patients. And you know, this is done in 6 weeks. And they have even better outcomes when you go to 12 weeks on doing this. That's why I did 12 weeks. That's why the course I created is a 12-week course. And it doesn't stop there. We also observed some rehydration detected on a T2 weighted image on an MRI, which I'll show you here in a second. And the icing on the cake is torn annular repair. So those are the outer rings that keep the jelly on the inside we're seeing in all patients. You can't do that with surgery. There's people going to get disc seal right now, injected into their discs to try to repair those annular repairs and tears. And you can do this naturally for a fraction of the cost. I think it's amazing. So let's take a look here. If you've been with me, you might have seen one or two of these in the day, but I got a couple of them and I put a new one in for you today as well. So let's look. So massive herniation right there. This is his disc. It's supposed to be in this shape like that. This is all nuclear material coming out, pushing on his nerve branch. You can't even see anymore on that side. This guy, severe sciatic pain, low back pain, weakness in his legs, abnormal reflexes, could barely sit at his job. This is 12 weeks later for him. Almost zero herniation. You can see his entire nerve branch at this point coming out, going down his left leg. That's amazing. No sciatic pain, minimal low back pain at this point, normal reflexes, and was able to perform his duties at work and be a great husband again. That's pre and post MRIs. That's a patient of mine. So I'm not just showing you stuff I'm finding on Google. Let's look at another one. Here we go again. Massive herniation right here. Pushing on a spinal cord, a thecal sac. Again, massive herniation right there. Symptoms: severe low back pain, sciatic pain, muscle weakness, constipation, couldn't even travel or be a dad properly. Let's look at him 12 weeks later after doing spinal decompression. Massive reduction of that disc. Massive reabsorption of that disc material. You can start even seeing his nerve branch here again versus there. Can't even see it at all. No sciatic pain, no low back pain anymore, normal bowel function again, returning to being able to run all his businesses again. I think it's amazing. Why stop here? Let's look at another one. Again, another massive herniated disc right here. Again, these are all patients of mine, guys. Massive disc extrusion right there. You can't even see his left nerve branch going down his leg. Sciatic pain. Again, low back pain. Was told by 4 surgeons that he needed surgery to fix this. Yeah, is that really the case? Well, let's go look. Here he is 12 weeks later. Minimal bulge at that point. You can see how the body is reabsorbing this disc material back in at this point at 12 weeks. No back pain anymore, no sciatica, no muscle weakness, and back to an active life. He followed my recommendations, came in and did decompression once a month. It's been 1.5 years now, and he's still totally pain-free. One of the things I also want you to see on here is I want you to see the color of his discs. So you see this gray color right here that tells us that these discs are becoming dehydrated. Look at the difference between that and that and that, 12 weeks. You see how much whiter they are? Well, there's only one reason that they're getting white, and that is because they're rehydrating. They're getting their nutrition back in. You can't do that with surgery, but you can do a decompression, which is incredible. Only when it's done right and you have the right guidance. All right, not convinced yet? Well, let me show you another one. So here's another patient. Just saw him the other week. Again, herniations here. Again, you can't even see his nerve branch right here at all. Here you can make out a tiny, maybe millimeter of it on that side, going down both his legs. Massive sciatica going down into his left leg. Severe low back pain, leg pain, sciatic pain, muscle weakness, abnormal S1 reflexes, very common symptoms you're going to see. It's common symptoms that surgeons are going to tell you that you need to go get surgery, you're going to be paralyzed, which is a bunch of crap. Here he is, 12 weeks later. Again, no back pain anymore. You can see the total difference in these discs right here. And look at this. You can see both nerve branches now. Okay, the white area is the nerve branch going down to one leg and then the other. You see the difference right there. Okay, these are 4 of my patients. So why do I share this with you? I share it to you, inspire you, and let you know. In most cases, you don't need surgery, and this isn't me. This is neurosurgeons telling you the same thing. So, you know, I hope that you'll go and explore spinal decompression. It is the most powerful tool that I've ever come across in helping people heal bulging and herniated discs, and I've been doing this a long time. If you do choose to go to someone's office, you're going to want to go and make sure that they are nationally certified in spinal decompression. Most offices are not, so you're going to want to ask that question. And they should be going multiple times. I have 6 national certifications from 2 of the largest organizations in the United States. So I want to stay up on top of that research for you and the information. And also, you know, has your doctor won any awards for it? In 2019, 20, and 21, I was voted one of the top spinal decompression doctors in the entire United States for the work I do. And I don't say that to ring my bell, even though I'm proud of it. I worked really hard for it. I just want to know that it can bring you value, and you know that you're going to someone that knows their stuff. So I created a course. If you don't want to go to a doctor's office or you don't have access to doctors, and it's called Disc University. And I teach you everything you need to know. So I created a course to help people all around the world who are suffering with back pain and spinal pain that either couldn't get to come see me, or in their country didn't have access to doctors with the knowledge that I have or the equipment. And so they keep suffering. And so, you know, God gave me a vision to take all my knowledge and to create a course where it would be almost identical to you coming to me, except I get to come to you on your computer. And you can take your time watching it. It's got 27 video modules, and I literally take you step by step almost every day and just show you exactly what to do, what to expect, how to help your self-healing, how to rehydrate your discs, how to get better nutrition in, what you should be taking, core exercises, and the list go on and on. I think you'll really like it a lot if you go check it out. So for some things, some benefits that you could have if you learned what I teach is you may sometimes, and sometimes do, people have immediate pain relief in their spine. I've seen that many times, or major improvements in it. You could avoid surgery in most cases. I could help you heal your spine instead of just patching it up. Give you hope for a better future of your life and yourself. Avoid painful and dangerous surgeries, because unfortunately a lot of these surgeries guys are doing now, they're very dangerous and incredibly painful, and you're never going to be the same again. And help you become active again and start doing the things that you love to do. How awesome is that? That's, I mean, God, that's what I want for all my patients. You know, if you do my course or you don't, I want that for you no matter what. But what might you continue to struggle with if you don't learn this information? Well, you could have unnecessary surgeries, and I see that a lot on Facebook, guys. So just because people aren't being told that this is an option for them. Spine pain that continues to get more painful as the years go on. Debilitating pain where you just can't do anything. Depression's very big in the spinal pain community, unfortunately. It is depressing when your back hurts you all the time and you don't know what to do, and you're afraid as hell to go get surgery because you think that's the only option. Anxiety of your future. What's my future going to be like? Painful injections, epidurals, hospitalizations, and living on pain medications, and possibly even getting addicted to pain medications. We know that's a real thing these days. So, you know, so what's it cost to do spinal decompression at home? Well, you know, I think it's all relative. So, you know, I put this slide up, and this is the cost of the most common surgeries for men and women in the United States. So number one being coronary bypass, and that comes in at a whopping $151,000 and change. But number two is spinal fusion at $138,000. So if you go get your spine fused, you're looking at a $138,000 bill. And your insurance is not going to pay for all that in most cases. So now you have the stress of hopefully you're better for some period of time, all the pain that you got to go through, rehabilitation to go through, and now you have the financial burden of having to pay these doctors, and that's if the surgery was successful, or if you had a failed back surgery syndrome, you still have to pay the guy. And then surgeries in your future, because you can't just have one based off of what Dennis McClure said, otherwise there would be no failed back surgery syndrome. So how can you avoid all that? Well, you can go take a look at the course that I created where I teach you how to do spinal decompression just like we showed you there from the comfort of your home, and you get to keep the piece of equipment, it's yours. And I teach you all the stuff you need. And so if you go look at my link on YouTube and Facebook, there's links to Disc University. There's one that I designed for the neck and one for the low back, so you pick the appropriate one. And you can do it all for under $1,000. And I did that for a reason. I want this to be affordable for people. I want to reduce and stop suffering of spinal pain around the world and give you expert guidance and make it affordable. And that's why I do this. And that's why I do this every week. So I ask you, please go take a look at Disc University. The links are in my bio. Tell me what you think. It's easy to purchase if you want. And we send you the piece of equipment. You get to keep it, and you get to go through each module at your own pace. I have it broken down. You just watch the first one and then the second one. I teach you everything I would teach you if you came to my office over a period of 12 weeks. And you get to come join my lives if you have questions every week as well, so you have access to me. So I hope you go take a look at it. I'm really proud of it. I put a lot of work into this. I think you'll really like it as well. And I think it's going to be great information. I think you'll feel that you got way more of your investment back than what you invested into it. So I love and appreciate you. Thank you guys so much for being here. If you have questions, leave me a comment. And I'd be happy to answer your questions about Disc University. If you'd like to talk about your MRI, leave me a comment, and we can set up a time to chat about it as well. So thanks so much for being here. Appreciate you. I'll see you next week, next Wednesday at 1 o'clock for Facebook and YouTube. All right, bye you guys.